Hi, my name is Mallory, and I'm a clinical and counseling psychology doctoral candidate at the University of South Alabama and completing my internship at the University of Oklahoma Health Sciences Center in Pediatrics Psychology. Along with my colleagues Jessica Van Ormer and Dr. Kimberly Zlomke, I examined the relationship between adverse childhood experiences and family resilience and how these differed among families of children with autism spectrum disorder, attention deficit hyperactivity disorder, comorbid autism and ADHD, and neurotypically developing children. Children with autism and ADHD are significantly more likely to experience adverse childhood experiences and are more likely to experience family conflict, poorer parenting practices, and have less time for family activities. And this is when comparing them to neurotypical controls. However, no studies have examined children with autism and compared them to children with ADHD on these variables. When examining adverse childhood experiences by diagnostic category and controlling for demographic variables, we found that children with ADHD had significantly more adverse childhood experiences in comparison to children with autism, children with comorbid autism and ADHD, and neurotypically developing children, and there were no other significant differences. When examining family resilience by diagnostic category and controlling for demographic variables and adverse childhood experiences, we found that children with comorbid autism and ADHD had significantly lower levels of family resilience in comparison to children with solely ADHD and children with neurotypical development. Also, children with autism spectrum disorder had significantly lower levels of family resilience in comparison to children with neurotypical development. When examining family resilience by number of ACEs, children who had experienced one ACE had significantly higher levels of family resilience in comparison to children who had experienced two or more ACEs. Surprisingly, families of children who had 0 ACEs did not differ from children who had experienced 2 or more ACEs on family resilience. Results have implications for early intervention, especially among children with autism and ADHD, which is further discussed in the full article.